Hodgkin's lymphoma, as we all know, is a very well-treatable disease for most of the patients, but if patients are primarily refractory or experience relapse of the disease, the outcome is much less good, and we are interested in the particular project I'm now summarizing here to exploit novel treatment approaches. Hodgkin's lymphoma is genomically undoubtedly a disease of B-cell origin, but the interesting part is that Hodgkin's lymphoma cells present with an aberrant plasticity transdifferentiation phenotype, and as part of this transdifferentiation phenotype among T-cell markers, macrophage markers, Hodgkin lymphoma cells lack largely components of the B-cell phenotype. This prompted us to ask the question whether genetic or pharmacological restoration of the B-cell phenotype in Hodgkin's lymphoma would be per se therapeutic and, more importantly, would generate novel targets as we know them from B-cell non-Hodgkin lymphomas. So what we did is we utilized a more than 28,000 compound library, pharmacological library approach, and based on an CD19 promoter luciferase reporter construct in a number of Hodgkin cell lines, we identified in a screen and a rescreen ultimately a number of compounds which were indeed able to re-evoke CD19 transcript expression. From that moment on, we focused on 3 compounds and undertook a number of functional experiments to further corroborate this finding. Just to summarize what we saw in a number of cell lines, that these agents were able to induce CD19 or CD20 transcript expression, including CD20 protein expression. We also looked at 2 different agents which were not part of the pharmacological library screen, arsenic trioxide and all-trans retinoic acid, both well known from AML, M3 or APL treatment as pro-differentiation drugs, also speculated to impact on B cells. We tested these 2 agents and indeed they also had restoration activity. This made us concluding that potentially the combination of pharmacological library screen identified compounds plus ARTO or ATRA in combination may even have a stronger impact on restoration of the B-cell phenotype. And we explored this, and to summarize this part, we particularly looked at the combination of arsenic trioxide and compound 40 and found a strong synergism in terms of CD19, CD20 expression, and looked in greater detail at CD20 surface expression by flow cytometry as well as by image stream X single cell analysis, and found indeed membrane re-expression of CD20. That's important because that's the second part of the story. This allowed us to formulate the hypothesis that now therapeutic antibodies like Rituximab or Tocilizumab might be effective against these surface B-cell phenotype restored Hodgkin lymphoma cells. And indeed that was in viability or antibody-dependent cell cytotoxicity assays indeed the case. Moreover, there's a number of tyrosine kinase inhibitors now registered in the treatment of B-cell non-Hodgkin lymphoma, namely the BTK proton tyrosine kinase inhibitor ibrutinib, the PI3 kinase inhibitor Idelalisib, and we asked the question whether we would have some partial B-cell receptor signaling restoration as well, not only surface receptors, but internal signaling restoration to render these Hodgkin cells now susceptible to otherwise rather non-Hodgkin tailored small compound treatments. And sure enough, when we used ibrutinib or Idelalisib in Hodgkin lymphoma cell lines, which are basically insensitive to these agents, but had these Hodgkin cell lines pre-treated with the restoration combination ARTO plus compound 40, we got dramatic sensitivity for these small compound TKIs. And that is actually an expandable result over a larger number of Hodgkin lymphoma cell lines. So this brings us at a level of preclinical research where we have a chemo-free combination, which is interesting for heavily pretreated patients, maybe elderly patients. In a future perspective, before we reach this, we of course need to refine dose, scheduling, assess toxicity. For this, we are currently in progress in establishing cell line-derived, patient-derived xenotransplant models in mice. We'll further look into the specific compounds we have identified by the pharmacological screen, optimized compounds, look at different or additional B-cell surface receptor and signaling targeting compounds, and also are of course interested in further elucidating the underlying mechanism, which we believe, based on current data, that it's probably an epigenetic restoration mechanism at a master regulator, master repressor of the B-cell program in Hodgkin's lymphoma. We see room for such a development despite, of course, exciting novel compounds, including checkpoint inhibitors, because this might be also in combination with novel, established or recently registered strategies, an interesting perspective for patients to treat Hodgkin's lymphoma in a later line or maybe in even earlier lines without any chemotherapy.